Good evening. My name is Georgina Ritchie and I'm the Director of Education from Accelerate CIC, which is a social enterprise. I'm really delighted to welcome so many colleagues from around the world to join us at what is evening for me, but might be a very different time for many of you. It would be great to hear a little bit about where you all are, and so I would encourage you to use the chat function on Zoom. Let us know your name and perhaps whereabouts you are in the world. So welcome to this series of 3 webinars where we're going to start with back to basics in skincare, and then in our second webinar we're going to look at treatment, skin tears, and then finally in our third webinar we're going to look at early intervention to stop skin tears from becoming leg ulcers. And this is part of a celebration of a collaboration between Accelerate and the International Skin Tear Advisory Panel. But before we get started, I've got some housekeeping. We will be sending certificates round about 72 hours after the webinars have finished. We will be recorded, and you will be able to access the videos on both the ISTAP and the Accelerate website, should you wish to come and watch us again, or possibly share the information with colleagues. Also, we will be having a question and answer session at the end of the presentation, so please do use the Q&A toolbox to post any questions for our speaker. And now it's my pleasure to introduce Mary Hill. Mary is a registered nurse, educator and consultant for integrated home care, specialising in wound ostomy and continence. She's also the ISTAP Regional Director of North America. And tonight she's going to be taking us through back to basics in skin tear. Over to you, Mary.
Oh, thank you so much, Georgina. I'm just looking at the chat and I just welcome everyone from all over the world. This is fantastic. Welcome. Today's presentation, we're going to cover some of the objectives here, and we're just going to go over the significance of the skin as an organ and some of the factors that affect skin integrity. We're going to look at factors influencing skin frailty, and we're just going to go through a little bit about aging and those risk factors around that. And then we're going to look at skin assessment components, the strategies to reduce the risk of skin frailty. And, you know, the role of education in maintaining skin integrity is so important. So I am from Calgary, Alberta, Canada. And for those of you who don't know, we are at a very high altitude and it's very, very dry. So if you're flying from the coast to Calgary, most of your skin moisture evaporates and everybody complains of a lot of dryness. Many of you will recognize some of these skin types. And these are people who have vulnerable skin types. And a lot of it is around aging, but we're going to talk a little bit more about that later. So I'd like to talk about the importance of skin. And the skin is actually the largest organ of the body, and it counts for 15% of our body weight. And the primary function of healthy skin is our barrier against chemical, physical, mechanical hazards, and invasions of microorganisms and allergens. In healthy individuals, the skin is strong, it's resilient, and has a remarkable capacity to repair. I'm going to talk a little bit about the barrier function of the stratum corneum. The barrier function of the skin is located here in the stratum corneum, and it becomes very important. It consists of corneocytes that are embedded in a lipid matrix, and this matrix is composed of ceramides, cholesterol, and free fatty acids. And it's the ceramides that maintain the water permeability barrier function of the skin. So when we remove the ceramides by repeated washing with detergents and soaps, we leave the skin condition that can become quite irritated. You can get dermatitis, you can get dry skin, and of course we affect that very important barrier function of the skin that protects us all. Transepidermal water loss, and I referred that to you a little bit when I talked about Calgary and losing all that moisture. But the TEWL, which is short for the transepidermal water loss, is the rate of which water vapor is lost from the skin. So any kind of external irritants that damage the skin barrier leads to water loss from the dermis and the epidermis. It's really important to maintain the acid mantle of the skin and also the skin lipids to reduce this risk of dryness and damage and the evaporation of moisture. So let's talk a little bit about the acid mantle. Now, the normal pH of the skin is around 4 to 5.5. It's called the acid mantle. And the acid mantle protects our skin with the help of sebaceous glands that secrete sebum, which lubricates and protects the skin from drying and cracking. When the skin pH becomes higher or alkaline, the skin is more prone to infection. And we know that soap adversely affects the acid mantle because soap tends to be alkaline, which means it has a higher pH above 5.5. Sometimes it's around 9.5 to 11. And this is why soap really should not be used on skin. And that skin cleansers with a pH balance, which is more neutral or slightly acidic pH, is best to maintain a healthy acid mantle. So what are some of the factors affecting skin health and in the integrity of the skin? So we've talked a lot about drying and the desiccation through washing the skin repeatedly with things like soap. And of course, age and skin type also are factors that affect our skin health. We just talked about Calgary, Alberta, environment and climate can impact our skin, as well as lifestyle and occupation. If you're a farmer all your life and you're outside working and exposed to the sun and the elements, that's going to impact our skin frailty and health. Nutrition and hydration plays a really important role. And peripheral circulation, and then that edema and swelling impacts our skin. And many of you may know that swelling of the legs, when the skin gets very stretched, it starts to weep sometimes and sometimes breaks down. So swelling is definitely a factor. Length of stay in the hospital is also an issue because when people go into the hospital, they do have limited mobility and they do get deconditioned, and this can lead to vulnerable skin. As we age, sensation of the skin becomes decreased, and of course, other factors our spinal cord patients also have no sensation to the skin. Level of consciousness, trauma, activity, and I also want to say that fecal and urinary incontinence impact the skin integrity as well. And we're going to talk about that in a bit. Fever, infection, metabolic state, and immunosuppression all impact the ability of the skin to protect ourselves. So we know that there's a lot of terms around what we are around skin vulnerability. And if you look at this slide, there's quite a few terms here that can be used to describe skin vulnerability. But with ISTAP, our International Skin Tear Advisory Panel, the best practice recommendations for holistic strategies to promote and maintain skin integrity, skin frailty was determined to be the terminology for all of these terms. So what is skin frailty? Skin frailty is an umbrella term for at-risk vulnerable skin. It differs from overall frailty. Overall frailty relates to overall health and several interacting factors such as physical, psychological, social, environment, and economic factors. Skin frailty represents a risk or a threat to the skin and is not necessarily a wound or a break or a disruption in the skin. It can affect all ages, particularly ages at each end of the life cycle. That would be the neonate and the older adult. And skin frailty requires a holistic, person-centered approach that improves outcomes, requiring an integrated strategy. And that's really important, and we'll be talking about that. So to you, I asked the question to my participants, and you can write these in the chat box, but what patient groups are at risk for skin frailty? And I ask you just to write down what your ideas might be there. I've got the elderly, the senior for sure, bedbound patients, neonates, steroidal clients on steroids. Yeah. ICU, 100%. Immunocompromised, chemotherapy. Excellent. Oh, you guys are great. Well, I've just added a few here for you to look at, but there's a range of people and you've hit on most of them. But the older adults, that's one predictability we have 100% that our skin is going to change as we age. But any individual with mobility issues, paralysis, our spinal cord clients and patients, children and neonates, individuals with spina bifida, cerebral palsy, the bariatric patient as well. Oncology and palliative patients are also at high risk for skin frailty, and anyone who has chronic illnesses or other issues, health issues as well. So what happens with the skin as we age? And because that is the one predictable factor for sure that we're all going to be doing. It tends to become thinner. It's got decreased epidermal turnover. It loses elasticity, so our collagen becomes denser and straighter, and our elasticity starts to be lost. A reduced blood supply is also an issue as we age. And of course, those people who smoke, that's going to be potentiated there. Subcutaneous fat decreases. Our skin hydration decreases. There's a reduction in the hyaluronic acid. And the hyaluronic acid is a naturally occurring substance that helps retain moisture in the skin and the eyes, and it lubricates our joints. And as we age, we lose our hyaluronic acid. The barrier function changes. So unfortunately, our acid mantle starts to change as well. And the Langerhans cells, which is our immune function in our skin, these are cells that determine our immune response that are in the skins, they get reduced by about 50%. There are changes to the demoepidermal junction. And when you see in this picture, you'll see that the papillary layer flattens out as we age. And you can see that with the rolls there. So I like this slide, the itch cycle, because it talks about how when our skin changes with aging, we have that decreased moisture and we have increased dryness. And this leads to people scratching the skin. And as they scratch the skin, we get that mechanical trauma that can cause the injury and also typically skin tears. And also with the decrease in sensation as we age, that risk gets increased for our mechanical trauma. And fingernails are not the cleanest part of our body either. So when they scratch with dirty nails, there's a higher risk of infection. So I wanted to talk a little bit about the extrinsic and intrinsic factors of skin frailty. So if an individual's skin has an enhanced vulnerability, they are at increased risk for skin damage. And this can encompass a range of issues. And some of these are extrinsic or maybe from the environmental, from the outside, and some are intrinsic. And I've just named a few here for as an example. So a skin tear would be an extrinsic factor where somebody has bumped their shin on almost always the dishwasher door that's been left open. So that's an extrinsic factor. And pressure ulcers are also extrinsic. When we expose clients with mobility issues to pressure in chairs and beds, that brings pressure injuries or ulcers. Aging, it's an intrinsic factor. Moisture associated skin damage. This is moisture that impacts our skin. It can be both extrinsic and intrinsic because let's look at fecal and urinary exposure. Sometimes intrinsically, people are incontinent for many different reasons, sometimes due to chronic illness or other factors. And then extrinsically, they can be sitting. Sometimes we have functional incontinence where some people are incontinent, but it's because they are unable to get to a toilet or are having difficulty getting to a toilet or have access to toilets. So in that sense, it's an environmental issue. Skin changes at the end of life is intrinsic. Smoking, of course, is extrinsic, and psoriasis would be an intrinsic factor. And so it's important to look at all of these factors and see if they're modifiable or non-modifiable. And some will be modifiable and some will not. So it's important in your assessment to be sure that you're looking at that piece as well. So here's another question. What factors might affect skin frailty in this picture? And please, if you could again put this in the chat, that would be great. Skin folds, incontinence associated, obesity, incontinence, pressure, immobility, bedbound. Excellent. Dryness. Those are fabulous, fabulous. So I just wanted to talk a little bit about the importance of skin frailty and how it can affect other types of different groups and different people. This particular lady would come to our clinic weekly because she had the skin breakdown on the back of her upper thighs. And she drove to the clinic every week and she dressed immaculately. But after a year of treatment, she didn't improve at all. And it was felt that we should maybe go into the home to see if there was some factors that might be causing the skin breakdown in this particular area. Took a lot of convincing to get approval for her to come to our home, come into her home. She was very hesitant. And a lot of people in home care they don't like people coming in. But we did get into the home and we discovered that she worked from home and she sat most of the day at the computer on a chair that was plastic and was too small. She also was incontinent of urine because she was not always able to make it to the bathroom on time. She dribbled a little bit during the day. And on days with higher temperature, the plastic chair would trap moisture against the skin as well. So a larger chair was ordered with a cushion and a cover, and the skin damage improved. But I also want to reiterate here and highlight other barriers to consider in this particular case, and in the case of clients, our bariatric clients. So insurance company coverage for the equipment. they needed it to have an accurate weight. And it's not easy to find appropriate scales, bariatric scales, and have access to these scales. And that became a barrier in this particular situation. There's shame and humiliation for clients, our bariatric clients, and there is societal biases towards them as well. And I just want to highlight this case to show that there are many factors that need to be considered when you're managing skin frailty. So let's talk about skin assessment for individuals with skin frailty. And a holistic, full holistic skin assessment should be conducted at the first visit or admission to any clinical setting. And it should be ongoing inspection of the skin. When we integrate a skin care regime. So we need to continually do that reassessment. It's also really important to document for communication and consistency of our skin care regime and any changes that might occur. So medical history of individuals, very important, as well as the type of medications they are on, because some medications can impact our skin. Nutrition is really important, and hydration. Risk factors for vulnerable skin that are diabetics, and there's thin skin, and how chronic disease affects the skin. And see if the skin is intact. Is there anything unusual? Are there rashes? Is it dry? Is there scratching? You can see the scratching as linear sort of breakdown. And are there skin lesions on the skin that you should be made aware of and maybe loop a physician in on? How does the skin feel? What's the texture? What's the turgor? And what's the temperature? Is there presence of existing skin conditions such as eczema? Or is there swelling anywhere? Is there pitting to that swelling? Is there pitting to the skin? Skin condition history, family history, and environmental influences become important when we are looking at skincare regime, and has the client had any previous treatments? Clients who have had radiation can impact the skin, as well as clients who are on dialysis. Our renal clients, their skin changes as well. Ask the patient what they know about their skin. And I talk to my patients all the time about moisturizing and protecting their skin. And I have to say that men typically don't do a lot of moisturizing. So I have to work very hard with the male clients to make sure that they are taking care of their skin. And again, that importance of documentation of assessment and that reassessment. And don't forget about different skin tones, because the skin may present very differently depending on the skin tone of the person. So how do we promote skin health and prevent skin injury? Well, regular moisturizing. And this has just been proven through studies that twice daily moisturizing improves and protects the skin. Reduce sun exposure. Minimize frequency of bathing. We don't need to be bathing every day, especially in our older individuals. Make sure your water temperature is not too hot. And be very gentle with the skin. Pat the skin dry with soft towels and don't rub the skin. Rubbing with a harsh face cloths on vulnerable skin can do a lot of damage. And don't forget about that continence management. That is so important. When we have urinary incontinence, when it touches the skin, it gets the urea in the urine changes to ammonia, and that ammonia makes the skin alkaline and it changes the pH of the skin and makes it more vulnerable to skin breakdown. Combine that with fecal incontinence, and now you have a bit of a recipe for really bad skin breakdown, because in fecal incontinence, we have bacteria, and as it mixes in with the urine, it continues to do more damage to the skin. So managing continence is very important. And in your skincare plan, it should be soap-free wash products. Try to use soft and disposable non-woven cloths. Regular use of emollients, moisturizers, creams, and ointments to replenish that skin barrier, and moisture balance to avoid maceration. So if a client is incontinent, you want, or has got a lot of fluid, maybe around a wound to be particularly, you need to make sure you're protecting the peri-wound skin from maceration. So maintaining healthy skin, emollient therapy with a ceramide is preferred, and it's a vital part of our skin care in patients with aging skin. This will help soften the skin. Emollients replace intercellular lipids and smooth the skin by filling in the spaces between the rough and dry skin cells. It promotes that moisture barrier function, and it slows the loss of that transepidermal water loss. And humectant is another type of moisturizer, and most moisturizers have all of these in them, and they retain moisture to the skin. They're moisture loving, so they attract moisture to the skin, and they are recommended specifically for dry skin. And occlusives are those moisture barriers or barrier creams, and they form a lovely protective barrier from noxious substances like urine and feces. It's important, really, research has proven that twice daily application of a pH neutral, perfume-free moisturizing lotion can help to reduce the risk of the damage. Optimizing nutrition and hydration is really important, and not a lot of our clients tend to be drinking enough and keeping hydrated. And optimizing our bathing, washing, and bathing routines is really, really important. It takes a team to have good skin health awareness, and we need to loop in patients and individuals, relatives and carers, because we cannot be moisturizing that skin twice a day, even if we tried. We're busy healthcare providers, and it's not easy to get that done. So relatives and patients should be made aware. Social care settings or residential care. Sometimes in those residential areas and care facilities, there's just not the ability to be having moisturizing of our clients. It just depends. Nurses are key. Healthcare support workers are key. Our social workers are important when we are looking at environmental and financial factors. We need our doctors to help us with medications, maybe prescriptive creams and those kind of things. Physiotherapists are so important to our team to encourage that mobility in our clients and strength in our clients to keep them moving. And occupational therapists are also key in assessing types of equipment that need to be in the home and ensuring that equipment is not damaging the skin or causing mechanical trauma to the skin, like wheelchair, legs, and those kind of things. And dietitians, loop your dietitians in to help support that skin and nutrition for healthy skin. So we're busy. Twice day moisturizing isn't always possible. This is why we need to include and empower our patients, families, and carers. It's best to give them written materials, give them verbal advice, make sure that we're identifying good, reputable internet sources for good skin health. And focus on what a patient needs to know and needs to do. And what I find is sometimes when family and carers come in to visit the patient, the best thing you could do, rather than while you're trying to strike up a conversation, is get some moisturizer in your hand and start rubbing it into their hands and their arms while you're having a visit, and their legs and their feet. And for patients, we want to promote their own self-care, and we have a checklist here for patients, and they need to advocate for themselves and empower themselves in their care. And this is a way that they can do it to be sure that they're given an individual skincare plan. Are they getting a emollient and moisturizing every day? Am I eating sensibly and drinking enough water? Am I keeping active and mobile? And are they wearing protective clothing? And protective clothing is really important. It's important for sun damage. It's important to protect against mechanical trauma. So long sleeves, there's things like shin guards, there's tubular bandages that can be worn on the lower legs, all to protect the skin. Has my environment been made as safe as possible? Adequate lighting, no obstacles. Have all of those area carpets been maybe put away so they're not a tripping factor? Have we got enough padding on furniture, and is there appropriate equipment in the home to ensure that they are having good skin health? And sensible shoes, uncomfortable shoes, and those should be worn in the house and outside as well. So I just wanted to bring your attention to the skin safety model. This can be found in the document that I'll be showing you next from ISTAP on the holistic strategies to promote and maintain skin integrity. And this model is really key. It helps you put a skin safety model into practice, and it puts the patient at the center of the care, and it helps you work through. I won't go into it in detail, but you can see here it helps you identify all the issues around skin health, and it brings a very holistic approach to managing skin health and skin safety in your care. And I ask you to go to the best practice recommendations. This is an excellent resource for you around skin vulnerability, and it guides you as a clinician to identify the risk factors of skin conditions and to promote skin integrity. And that is the end of my my presentation. I wanted to thank Samantha Holloway for graciously giving me permission to use some of the pictures and slides for this presentation. And these are the references. So thank you very much, and I think we can take some questions.
Thank you, Mary, and thank you to those of you who have put some questions through to the Q&A toolkit. We've been picking those up as we've gone along. So I've picked a few out for you to answer, if that's all right, Mary.
Yeah, sure, absolutely.
So the first one, I can't tell you who sent it because it was an anonymous participant, but it said, what soap substitutes would you recommend for use?
Well, the skin, what are they called? The skin cleansers that you buy in the stores are typically the better ones. I like the Dove gel cleansers, the shower cleansers are usually the better ones. Soap is not a good option. So I think Dove soap is, if you had to use a soap, Dove is the best soap, but you've got to get it down from that high pH value. You want to stay away from those. So yeah, and those skin gels and shower gels, they should, you know, the ones that you can leave on, they can be rinsed off, but they leave a nice protective film. Those are the best. A lot of facilities will provide you with some kind of pH neutral skin cleanser.
Thank you, Mary. So another one that we picked up, this was in the chat box. What products are best to treat excoriated groin, perianal and crease areas, most likely caused through moisture-associated skin damage?
So can you repeat that one again,
Yeah,
Georgina? What?
it's a bit of a complicated one. So
Yeah.
which products are best to treat excoriated groin, perianal and creased areas, in brackets, moisture-associated skin
Yeah.
damage?
Okay. Well, I always go back. It's never about the product. It's always about treating the cause. So the first thing I'm going to challenge you all is to figure out what is causing that moisture associated skin damage in that area and see what you can do to reduce the cause of that. Zinc oxide creams are our #1 barrier in that area if it's fecal and if it's fecal or urine incontinence. But I want to be cautioning you, if you put a lot of zinc oxide cream on down there like butter, and they're wearing incontinence pads, that's going to affect the ability of the incontinence pad to absorb any kind of urine. So if you're going to put zinc oxide in that area, it should be very a thin layer. There are dimethicone creams that are clear that actually provide a very nice barrier in the area as well. And I caution you again with the cause of the skin folds. You want to make sure that they're not fungal related. So you don't want to be throwing creams on fungal infection. It just won't improve it. So you need to treat those with antifungal products. So barrier creams in those areas that I mentioned, and be sure that you're looking at the cause and trying to treat the cause of that moisture associated skin damage.
Thank you, Mary. So I've got one here from Leanne, and it says, what is the best low-cost daily moisturizer you could recommend?
Well, I can't recommend necessarily a low cost one, but what I do suggest to all of you is to get familiar with your types of emollients, the ingredients of your moisturizers. Take a look at those and get familiar with them. All moisturizers usually have a humectant and they have an emollient already. And you do want to stay away from those high sensitizing ingredients, like lanolin is one. Um, what's another one, Samantha? Lanolin, any well, I messed up, but lanolin's a sensitizer. You want to stay away from high content of alcohol as well. You don't want, so start looking at the ingredients of your moisturizers and get familiar. And there is some really good documents out there and resources around emollients, humectants, and what are those and what are in them. So
Few people have typed glycerol into the chat, Mary.
yes, thank
Yeah.
you, glycerol. Thank you.
Okay, so we've got one from Olga now, and Olga's asking, what's the difference between humectants or hydrating emollients, and which is better in this case?
Well, and that's the thing, is in moisturizing creams, you're going to have a little bit of everything. But humectants are water loving. So they attract water and moisture. So those ones you want to use in dry skin. If you need, if you're having a moisture associated skin damage, you need to have um, an occlusive barrier. And that usually is typically a petrolatum, dimethicone, zinc type of thing. I could go for hours around emollients and humectants, and I don't want people to like the ceramides and the emollients are really important to give that to lend that lipid layer back into the skin and fill in those breaks in the stratum corneum that you get as well. Like we could do a whole sessions on lotions and potions.
Thank you. Okay, so I've got one from Patricia here, and it says, please can you comment on the latest evidence with regard to the ingredients parabens, tocopherols, and sodium lauryl sulfates within emollients with regard to damaging skin integrity? So
Oh,
I'm trying to read them slowly, Mary, because they're quite long ones.
yeah, the parabens. Again, what you need to be really clear on is getting familiar with your ingredients and what they are. I'm always looking at ingredients and percentages of ingredients when I look at moisturizers, and they all have some of them in there. But sometimes I think, go with a trusted brand. We're international, so I don't want to suggest any particular brand, but there's some very good dermatology supported brands out there that have less sensitizers, are perfume free. Again, you need to be looking at your ingredients.
Okay, so this one I've got here from Christiane. I think links into one of the previous questions, but I'll read it out because it might be just to reinforce a little bit. Do you have any recommendations in using antifungal cream in combination with zinc oxide spray for moisture associated skin damage with fungal component?
Well, I just actually covered this. And I do caution everyone with what we call as off-label use. And I call them kind of potions and concoctions. And, we all do it. We like to mix things up. But when a company puts up a certain product on the market, they have a lot of research and development behind it. And then we have a lot of regulations that needs to go through to be approved based on that research and based on the purpose and the indication of that ingredient. So when we start mixing ingredients that's called off-label use, and it can cause skin irritation, skin dermatitis. It can potentially cause allergens. So I caution you to make sure that if you're going to be doing it off label, you know what you're doing. Maybe you want to talk to your team and your pharmacist. Maybe sometimes physicians order these things, and that's fine. But when you personally start mixing things together, that's called off-label use, and sometimes that can cause harm to the client. You should always be using ingredients that have that good evidence-based research. And I guess I'm going to go back to you all. If you feel you need to be combining ingredients because one ingredient isn't working over another ingredient, I'm going to take you back to the cause. What really is going on there? You really need to go back and reevaluate your cause and maybe reconsider. Maybe you need to do a dermatology consult or and involve your team so that you can reevaluate, reassess your skincare regime.
Thank you, Mary. Well, I think we've certainly put you through your paces in that Q&A session, so thank you very much. We have come to the end of our webinar now, so it just leaves me to say thank you. Thank you to you, Mary, for presenting, and also thank you to our colleagues from all over the world looking at that chat box. Thank you for joining us. We'll be back in 1 month's time with the second webinar in our celebratory webinar series to launch the collaboration between Accelerate and the International Skincare Advisory Panel. So thank you so much for joining us.
Thank you.